5 facts about ADHD that might not be well known. Number 5. Multifactorial causes. Attention Deficit Hyperactivity Disorder, ADHD, is a complex neurodevelopmental disorder that arises from the interplay of multiple factors. While the exact causes of ADHD are not fully understood, research suggests a multifactorial etiology, involving a combination of genetic, neurobiological, and environmental influences. Various genes related to neurotransmission, specifically those involved in the regulation of dopamine, norepinephrine, and serotonin, have been implicated in ADHD. These genes influence the functioning of key brain areas responsible for attention, impulse control, and executive functions. Number 4. Lifespan impact. ADHD is not limited to childhood. It often persists into adolescence and adulthood. If left untreated, it can lead to difficulties in academic or occupational performance, interpersonal relationships, self-esteem, and overall quality of life. However, with appropriate interventions and support, individuals with ADHD can effectively manage their symptoms and thrive in various aspects of life. Children with ADHD may experience emotional difficulties, including low self-esteem, frustration, and increased risk of developing anxiety or depression. The challenges they face in academic and social domains can impact their overall emotional well-being and sense of self-worth. Number 3. Diagnostic criteria. The diagnosis of ADHD is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Different subtypes of ADHD include predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation. Diagnosing ADHD requires a comprehensive evaluation that includes a detailed history, observations, and assessments. It is crucial to consider other possible explanations for the symptoms, such as learning disabilities, anxiety, or mood disorders, as these conditions may coexist with or mimic ADHD. Number 2. Prevalence. According to the American Psychiatric Association, it affects approximately 5% to 10% of children and 2% to 5% of adults. However, these figures can vary across different populations and countries. While ADHD is commonly associated with childhood, it can persist into adolescence and adulthood. Studies indicate that approximately 30% to 60% of children diagnosed with ADHD continue to experience symptoms in adulthood. However, the presentation of symptoms may differ in adulthood, with decreased hyperactivity and increased difficulties related to attention and executive function. Number 1. Neurodevelopmental disorder. Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults. Many neurodevelopmental disorders have a genetic basis. Certain genes and gene mutations have been linked to conditions such as ASD and intellectual disability. However, the genetic landscape is complex, involving the interplay of multiple genes and environmental factors. Early identification and intervention are crucial for neurodevelopmental disorders. Timely assessment, diagnosis, and access to appropriate therapies and support services can significantly improve outcomes and minimize the impact of these disorders on individuals' lives.